So ACT really came out of behavioral therapy. So you had behavioral therapy where you change behavior by engaging in behavior. So the behavior therapist, you would figure out a behavior you wanted to change. They would give you homework, you would do things. This is where a lot of if you had phobias, you would be exposed to things, you would get reinforced for it. So it came out of behavior therapy, but it added a little bit of an existential piece, which I think is fun. So the existential piece is kind of, why are we here? So it's not enough to say, hey, we know the tools to change behavior, let's change behavior this way. But what is that existential piece of why are we here? What are we working for? What are our values? So it's also an acceptance plus a commitment to action. So at its core, you accept what is out of your personal control, and then you commit to action in line with your values. You do this through promoting psychological skills to deal with thoughts. So that's where your mindfulness component comes from. And then the values, which is clarifying what is meaningful to us. Brief history of ACT, three-wave behaviorism. The first, the focus on operant classical conditioning. The second wave in the 70s was more of a focus on thoughts and a focus on cognitive behavior therapy and rational emotive behavior therapy. So this is when Beck and Ellis came on the scene, and you see a lot of cognitive therapy. So let's talk about irrational thoughts and how irrational thoughts create emotions. And if we replace irrational thoughts or thoughts that don't serve us with more adaptive, proactive thoughts, then we'll see changes in our emotion and how we feel. And then some would say that the third wave, which is right about now, is adding acceptance and mindfulness in addition to traditional behavior intervention. So some would describe ACT as being part of radical behaviorism. So in radical behaviorism, everything an organism does is behavior. Thinking, feeling, remembering, all forms of behavior, all are important. I really like Oprah. She interviewed Brené Brown. Does anybody know who she is? No. She wrote a book called Daring Greatly. It's a really good book. And she basically is a qualitative researcher in the human sciences. And she was really interested in just the human experience. So all her team does is interview people and try and find themes based on human experience. So she interviewed people with grief. And there was this one example that she used where this husband described losing his wife. They spent their whole life together. And he said, I was always afraid of losing her. That even when we had moments of joy, I would kind of step back and be like, oh my God, one day I could lose her. And he said, and then I lost her. So all of the time of worrying about that didn't prevent me from losing her, but it also didn't make the pain any less. So she used the phrase, which I love, dress rehearse tragedy. So sometimes we as humans think if we dress rehearse tragedy in our minds, we visualize it, we practice it, that when we experience it, it won't hurt as bad. And it's probably not the case. But that's an example of how, regardless of what's going on, just the internal workings of your mind. The goal of ACT is psychological flexibility, right? And then there are 6 core principles. The first, the present, being in contact with the present and not being in the future or stuck in the past. The second is values. So you know what your values are, you know why you're here, you know what the meaning is. Not to say that won't change tomorrow, that's okay, but you know the direction you're going in, and a lack of direction is the opposite of that. Committed action towards moving towards your goals, and the opposite is being stuck The self as context rather than the self as content. Diffusion, which the opposite is cognitive fusion, and acceptance, which the opposite is experiential avoidance. So the tiger example is if you imagine a baby tiger in your house, cute little baby tiger, and he's hungry, right? And you're afraid of him, and you don't want him to bite you, so you feed him. Then he's hungry again. You're afraid of him, you don't want him to bite you, so you feed him. And you keep going back to the fridge, and you keep feeding him. What's happening to the tiger? He's getting big, and he's still hungry. And then eventually, you go in the fridge, you don't have anything left except yourself, right? So then you're no longer acting in line with your values because you're feeding the tiger or you're feeding the anxiety. So if the only way you can control that anxiety tiger is by staying home in your house, locked up and feeding it, then that may be a time where you would want to practice more acceptance.
I just think that what we have to do is try to make sure you feel safe enough that you can make mistakes. When I would say pushing the envelope, it's more about taking small risks that are really not comparing yourself to other people in the room, but it's comparing yourself to your previous actions and small steps that you take. It's really about feeling safe and creating a culture where you feel comfortable making some mistakes. And as long as they're in line with the values, behavioral principles, and your family, and the best interest of the learners we serve, everyone here knows that I'm like making mistakes. Because then your intentions are in the right direction, and it's okay that you make some mistakes because it's encouraged and it goes in line with the values. So I really feel like, you know, life is risky. You know, you're not going to get out of it alive. But yeah, you're really never going to accomplish anything innovative or change lives massively or do anything within your values unless you take those risks. So just being comfortable to take the risk, I think, is really important. I hope you all feel the level of safety to be able to take some risks. And that's, you know, leaving the house is one. I mean, there are days just leaving the house is like a big deal. Yeah.
Help others identify their unhelpful processes, so what they may be doing. A lot of parents we deal with may in fact be engaging in unhelpful processes because that's what they've learned to do to keep the train running, right? So being able to identify with them.
You think that if you're able to understand the parents' values from a behavior analytic standpoint, then you understand their reinforcers. So if you understand their reinforcers, it gives you the opportunity to have them act on your suggestions, right? So if you're understanding what parents care about, and I think sometimes we get too rigid with rules, and we just had a discussion last night about, you know, the funding source saying, no, you know, you can't be alone with the kid at all, and this and that. And I said, look, if the parent values a couple moments of silence to themselves, and that's the big reinforcer, I'm not talking about all-out rescue, I'm talking about 10 minutes to themselves. If that's what they value more than anything, and you take the learner and you work with them, and you know that that's valuable to the parent, you can use that to engage them one step at a time, because then you've paired yourself with their values. And I just think we have to be flexible that way. That's one application I would think. You're the expert on that.
I love that quote.
Yeah.
When you know their values, you know their reinforcers. Quote of the day. That was a good one.